Hi, I'm Dr. Boris. I'm an optometrist at Uptown Eyes, and I'm going to talk a little bit about what kind of tests we do when a child comes in for their eye exam. So there's a lot of things that we evaluate during a comprehensive exam, everything from whether or not they need glasses, to how their eyes focus, to how their eyes work together, as well as just a general, really good, thorough evaluation of the health of the eye. So I'm just going to show you a few of the instruments we might use, and just let you know that it's really a lot of fun to come to the eye doctor. So here, this instrument is a phoropter. So it is mainly used to check to see if you need glasses, so to determine if you're like farsighted or nearsighted. Nearsighted just means that you can see better up close, and farsighted means that you can see better far away. For children, sometimes we have to use other instruments to be able to get a more objective determination of the prescription, so that we don't necessarily need much feedback from the child. So, and then this right here is called the slit lamp, and it is mainly just a microscope, so it helps us to really look at the health of the eyes. We can check for anything from any retinal problems to allergies, dryness, that kind of thing. So we can treat allergies here, or we can also refer to an allergist if we think that it's necessary.
What age do most kids need to have their first exam?
Well, we see as young as 6 months, but we say at least by school age, so that we can determine, prescription, just make sure that there's no eye problems that might hinder learning. So.
What signs do you need to look for in your child to know whether or not they need to come in maybe sooner, or if they're having difficulty at school, or what do we need to look for?
Some of the main symptoms would be like if they are holding reading material really close, or really trying to get real close to the TV. Definitely if you see one eye turning in or out, that's a big one. If they're not doing as well in school, like having trouble reading or skipping lines when reading, or complaining of headaches.
Okay.
Hi, I'm Dr. Holly Anderson, and I'm just going to talk to you a little bit about the eye charts that we use to test your vision. For children, especially children that don't know their alphabet, we do have different, what they call optotypes. So there's pictures, and so that would be great. I know a lot of people are concerned about maybe their children not being able to recognize the letters. So there's different ways to go around that. The other thing I was going to mention to you guys is that the number here, 60, that represents what this line means, 20/60. Obviously our goal is 20/20 vision. Those numbers, the larger the bottom number, the larger the image or letters are, and the worse the vision is. So obviously we would want 20/20, and there is such thing as 20/15. I'm going to explain to you some of the different equipment that we use for eye exams for children and adults. This first instrument here gives us a starting point for your prescription, and it also reads the curvature of your eye for contact lenses. This one in the middle deals with your side vision, so we can test your peripheral vision, just a screener. And then our last instrument here is our fundus camera, where we can take images of the inside of your eye so we can assess the health. All right, so just look straight ahead. You will see a little green flashing light. Watch that green flashing light for me. Good. Oh, he's doing so good. Okay, so this is an image of inside of the eye. This entire picture is the retina. This structure here is the optic nerve, and we watch that for optic nerve diseases like glaucoma. This dark area here is called the macula, and that deals with your straight ahead detailed vision. Very, very healthy. And then of course the blood vessel structures that feed the retina. So this is a perfect eye, and this is what we like to see here.